All right, another quick update vlog as relates to Kayla Pollock. If you didn't see that interview, Kayla Pollock is an Ontario woman who was rendered a quadriplegic after her Moderna booster after 2 Pfizer shots. She took 2 Pfizer shots and then decided to go ahead with the booster, and for whatever the reason, the medical professionals gave a Moderna booster. I guess the science at the time was you could just mix and match willy-nilly. After her Moderna booster, shortly thereafter, she started having neurological issues and was ultimately, within short order, diagnosed with transverse myelitis. She's been rendered a paraplegic. We can always hope for miracles, but by the looks of it, for life, will need lifelong care. The connection between the Moderna booster jab and her adverse event was basically confirmed by the doctor. She recorded the conversation and the doctor says he had been seeing a lot of this. Don't know how you qualify a lot, but that's what the doctor said in the recording that she got with the doctor while she was lying paralyzed on a table in an ER being diagnosed with transverse myelitis.
Basically, it's either a tumor that has to be removed.
Less likely, right? Less likely tumor.
Okay.
Right, less likely.
What's a cancer workup mean?
Well, maybe CT, chest, abdomen, pelvis, just to make sure there's no other areas of malignancy.
Okay.
So that's what that is. But most likely it's going to be probably, if I'm using my gut impression here, from the vaccine.
So other people have had it though?
Many people have had it.
Many?
Many.
She was on my channel. We did an interview. She went through everything. She has a Give, Send, Go. For those of you who don't yet know, I'll provide the link in the pinned comment. She needs lifelong care, and the Canadian healthcare system, free Canadian socialized healthcare system, is so dilapidated, so ill-equipped to deal with Canadians' needs that she was actually offered MAIDs. For those of you who don't know what that Hitlerian acronym is, Medical Assistance in Dying in Canada. It's a euphemism for euthanasia, what other regimes of other eras called mercy killings. She was literally unsolicited offered MAIDs by the government, basically them saying, you're not going to get any better, and we're not going to be able to treat you any better. Have you thought about offing yourself? I've made it something of a personal mission to see to it that I can give as much spotlight to this Give, Send, Go and her plight as humanly possible. And tomorrow, as at the time of shooting this vlog, we're going to go on Dr. Drew, talk about it, and talk about her lawsuit, which is the purpose of this vlog, her lawsuit. She is suing Moderna for damages, punitive, all sorts of damages. I'll get into the headers in a bit, but she's suing Moderna for the damages resulting from her adverse reaction, which can, at the very least, in as much as it can be conclusively determined to be the 1 in a million, but when it happens to you, it's the meaningful adverse event connected to the booster jab. All right. Some people online had been asking me, how can you sue the pharma companies in Canada? I thought they were given immunity, and I had to take a step back and say, how is it that we're suing the pharma companies in Canada? There are few and far in between who are suing the pharma companies for damages resulting from injuries from the jab. Dan Hartman, Sean Hartman's father, is also suing Pfizer, also using the same law firm, sheiklaw.ca, S-H-E-I-K-H law.ca. Umar Sheikh, very, very good, determined lawyer, set on fighting the proverbial David versus Goliath. He's also representing Dan Hartman, who's suing Pfizer for the death of Sean Hartman, his 17-year-old son, who died 33 days after his first Pfizer jab, after having been hospitalized shortly after the Pfizer jab. He's suing Pfizer, and I got to thinking, how are they doing it? And I had to go look a few things up and consult with bigger brains than myself. And yeah, it turns out that in Canada, we have a bit of a different issue than in the States. In the States, the government immunized pharma companies through the PrEP Act. Through a piece of legislation, the government decided to immunize pharma companies from any damages that might be claimed by people injured by their medical products. It's not quite the same thing in Canada, and it was really only in rereading an article from 2010 that I truly appreciated it. In Canada, there was no legislative immunity given to the pharmaceutical companies. It looks like it was more of an indemnity in the contracts negotiated with the pharma companies, and now might be a good time to refresh everybody's memory as to what Anthony Housefather now infamously said. I'll play that again just to refresh everybody's memory so it's out there in the internet.
These agreements require employees of the government of Canada that access these documents to sign confidentiality agreements. And why is that? Why is there much more redactions, as my colleague said, in these documents than in other documents? It's because these documents were signed at the beginning of the pandemic, when everybody was desperate for vaccines, when companies were being told to rush vaccine production, do testing in an unprecedented way, in a way they normally don't do it. So these companies were exposed to way higher liability, putting their products on the market than they normally would, because they didn't do the type of testing that normally takes these drugs years to come to market. They did it all in less than a year. So that's why these companies said, if I'm going to deliver you this product that I haven't tested in my normal way, I want to have different conditions. And with countries around the world competing with each other to get these, the countries had less leverage than they normally do. For example, if we were entering into flu vaccine contracts or monkeypox contracts or other things that were normally available, this would be a different issue. But these are already signed. They were signed at a time the government didn't have that leverage in negotiations. We just wanted to sign as many vaccine contracts with as many producers as possible because Canadians were desperate for vaccines. And in the end, it worked out. We got vaccines, and we were one of the countries that got to vaccinate everybody the fastest.
And so going back in time, rereading an article from 2020 in CTV News, it all makes a little more sense. City News, COVID-19 vaccine makers not legally liable in Canada for rare side effects. December 14, 2020. It's amazing how they knew the side effects would be rare before they even started administering them. The federal government says Pfizer and other drug makers won't be held legally liable if there are severe side effects to their COVID-19 vaccine. Just last week, Health Canada cited contract confidentiality in refusing to tell us if any drug makers received indemnification for their vaccines, meaning they wouldn't be held legally responsible in the very rare scenario that a vaccine causes injury or a severe reaction. However, on Monday, as the first shots were administered after arriving in Canada on Sunday, Procurement Minister Anita Anand made the confirmation. Quote, "We are definitely not any different than any other country in this world," end quote, she explained. Quote, "Let's be clear that indemnification clauses in vaccine contracts are standard. All countries, generally speaking, are faced with the issue," end quote. Prime Minister Justin Trudeau only offered vague assurances when he was asked about the issue last week. Quote, "The contracts signed. There was questions for liability and Canada has undertaken the necessary measures to ensure that everyone is protected," end quote. He said, stressing the government would not approve a vaccine unless it's safe. The distinction between immunity and indemnification is subtle to some extent, but critical in that immunity is basically a bar to suing in the first place. Indemnity clauses mean you can sue the party, but that party can call in warranty the person who has agreed to hold them harmless or indemnify them, which means that basically Moderna and Pfizer can get sued in Canada, and if they have indemnity clauses in their supply agreements or contracts with the government, they can then call the government in warranty and say, whatever we are held liable to pay to the plaintiffs, you are liable to indemnify us for. And so that's where we're at now. Dan Hartman's lawsuit against Pfizer and Kayla's lawsuit against Moderna are very similar. They're sort of drafted by the same lawyers, so they're going to be by and large the same, and I'll just go through the essence of Kayla's lawsuit against Moderna. In the claim, plaintiff Kayla Pollock claims a variety of damages, non-pecuniary in the amount of $5 million, compensatory damages for $2.5 million, and the list goes on. The lawsuit describes the parties and goes through some of the facts, but you already know those by now. Paragraph 6, on September 16, 2020, the Minister of Health, pursuant to subsection 30.11 of the Food and Drugs Act, issued the interim order respecting the importation, sale, and advertising of drugs for use in relation to COVID-19. The order. Paragraph 7, the order inter alia allowed for a, quote, fast track, end quote, process for approvals from Health Canada for COVID-19 vaccines. Under the fast track process, manufacturers were able to apply for authorization of sale and distribution of COVID-19 vaccines without the completion of all research studies, and Health Canada committed to review new evidence of a vaccine as it became available on a rolling basis. Paragraph 13 is important. Moderna's COVID-19 vaccination was built on mRNA technology, which had never been used in the delivery of vaccinations on Canadian citizens, and in particular coronaviruses, which include SARS-CoV-2. The lawsuit then goes on to talk about certain public statements made by Stéphane Bonkel, the CEO of Moderna, and bear in mind, if I'm not mistaken, Moderna had never put to market a medical product in the history of its existence. And to oversimplify the rest of the lawsuit, but to simplify it accurately nonetheless, the lawsuit goes on to allege that Moderna failed to do basically basically any aftermarket surveys to follow adverse reactions, that they had no basis to make certain statements that they were making publicly, and that they basically utterly failed in putting to market a safe and effective product. But most importantly, that they failed to warn people, to adequately notify people so they could give informed consent about the risks of adverse events from their product that they knew of. Paragraph 36, the defendant further breached the standard of care when they knowingly and recklessly disregarded and misrepresented the results of the safety trials by, inter alia, going to paragraph C, not highlighting all safety results and adverse events revealed in the studies conducted, and D, not immediately halting the study and subsequent vaccine administration on Canadians due to known safety concerns revealed in the study. Negligent misrepresentation in paragraphs 37 and following. A, that they failed to disclose that there was an increased risk of acute transverse myelitis, quadriplegia, and paralysis after receiving the mRNA COVID-19 vaccine. And C, the defendants failed to complete post-market surveillance and inform the government of Canada and the public of the results. Negligence at paragraph 48 accuses Moderna of failing to continue to analyze incoming data, research, and science on both their products specifically and mRNA technology generally. So that is the essence of the lawsuit for all intents and purposes. As far as I know, as of the present date, there haven't been any motions to dismiss right off the bat, invoking alleged immunity that would preclude a lawsuit in the first place. There's no amount of money on earth that can possibly compensate Kayla for what she has gone through, that can possibly compensate Dan Hartman for what he has gone through. No amount of money on earth. But we are going to hopefully sooner than later start getting the victims the compensation that they so desperately need, and I hope start imposing the punitive damages that these pharma companies so desperately deserve. So stay tuned. Developments coming. If you're watching this today as of, February 28th, tomorrow we will be on Dr. Drew talking about this. All of the relevant links are in the pinned comment, and more important than anything, I guess, get out there and start raising awareness. Now you know your Vlawg peeps. Peace out.
Bottom line is, if anyone who doesn't have a legitimate medical reason for not getting fully vaccinated chooses to not get vaccinated, there will be consequences.